earlier on from the last conference, we found out that the highest causes of death are communicable disease, with children having the highest tally, and the causes are from malaria, diarrhea, and pneumonia. But for adults, the causes of death are the opposite, which is the non-communicable disease, such as stroke. So with these facts, Madagascar clearly needs improvement in the public health. So we have listed 3 issues, with the first one being utilization health services.
Yes, so people in Madagascar are heavily influenced by cultural beliefs of public medical.
People also disregard the medical opinions of their doctors, and this will lead to them refusing or misusing their medicine.
There's also a lack of medical services, and it's also very difficult to transport care to rural areas.
Food security is also an important issue.
Poverty plays into this since people cannot afford food.
Right, and with the unhealthy foods, it will cause the malnutrition, which then later weakens the immune system, and then later increases susceptibility to diseases.
And also many cultural beliefs prohibiting people from consumption of certain food.
Natural disasters also mean that crops are unable to grow, and that affects the food sources for everyone in Madagascar.
Lastly, water and sanitation is also important.
Specifically, there are 11 million people in Madagascar who do not have access to uncontaminated water.
And on top of that, people defecate on their water resources.
Natural disasters also play a role in this. So cyclones can raise the water levels and then contaminate everything else.
Furthermore, 18 million people do not have access to adequate sanitation, especially in rural areas.
And again, cultural beliefs are an issue since some people consider it bad to have a toilet in their house.
More importantly, schools lack clean water and sanitation, therefore students don't show up, and they are the future of Madagascar.
So clearly, Madagascar needs immediate action to happen.
Yes, we definitely need to do multiple educational talks throughout the country.
And these talks need to be carried out in hospitals, primary care centers, and schools.
And international groups like UNICEF can also participate.
Those are good ideas. So who would be our target group of people?
Well, the first group should be mothers or soon-to-be mothers, and we should talk to them about proper nutrition and how cultural perceptions around particular foods are counterproductive. More importantly, the clean water issue that should be talked about.
And we're also targeting students, which we want to break the unwanted cycle for future generations. And we're going to talk about the major risk of their unhealthy behaviors and also to prevent unsafe sex around them.
And the third group are patients already in hospitals and primary care centers. And doctors in these areas need to talk to their patients about factors that contributed to their illnesses, how the patients got their illnesses in the first place, and they should recommend healthier lifestyle choices and place extra emphasis on the importance of using and finishing the medicine that was assigned to them.
Those are great ideas. And I think along with the educational talks, we also need to give care packages to those people.
Yes, and in these care packages, they can contain the bare necessities for them. So like insecticide, treated bed nets, condoms, face masks, or water purification tablets. So we definitely need donations and sponsorship from large organizations.
Aside from donations, so how should we proceed with the educational talks and care packages?
Primarily through volunteers, which needs to contain professionals who are trained and this will enable them to have patience and flexibility to talk to their patients. And these educational talks need to talk to them about more about their illnesses and how the factors that contributed to their illness. And the more they know, the better the future will be. And they also need to distribute care packages that need it the most, especially in rural areas.
So we need to give time to the citizens to utilize the new information and the materials they receive and to learn what they need to do for the future.
It's great.